So even if somebody was to say, the argument isn't even this, we know these don't protect against viruses. They don't protect against particles that small. And if people want to say that, they're going to encapsulate big droplets and stuff like that, yeah, maybe some big droplets, a lot of small droplets will come through it. This offers far superior protection to what people are currently using right now. Okay, mm-hmm. But even if it was 100%, then you're still going to have virus exposure through the pores of your skin and your eyes. And it's not going to make any real difference at all.
Drea Humphrey here with Rebel News, and at one point we were repeatedly warned about COVID-19 being so easily transmitted. We allowed healthy people to be quarantined, and it had a domino effect on our entire country.
There's no reason to be walking around with a mask.
Why was there not a sigh of relief or a relaxing of restrictions when the World Health Organization explained that the healthy and asymptomatic people are not the big COVID spreaders we were once warned of?
But from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
Similarly, the World Health Organization now acknowledges that requiring humans to stay 2 meters away from other humans is unnecessary. Right in their protect yourself and others from COVID-19 guidelines, the advice is that maintaining at least 1 meter distance between yourself and others is sufficient. Yet have you seen any businesses revise their 2 meter COVID restriction signs or their red circles that you have to line up at to buy groceries? I haven't. Would someone please share this good news with this funeral home? Look at that. So quick to rush back to a 2 meter distance like a prisoner stepping out of line during roll call. According to Darren Grimes, that was sons trying to console their mother at their father's funeral. And speaking of the cure being worse than the virus, contrary to popular belief, it's not conspiracy talk to point out that yes, while wearing masks can have benefits in very rare and limited circumstances, there are also risks to wearing masks in general, especially now that many of us are being forced to wear them every single day.
The facial coverings can cause a different type of problem. With kids returning to school, local doctors say children are at a heightened risk of contracting impetigo.
Dr. Dahlia Wax discussing the latest issue in the oral hygiene world that appears to be caused by constant mask wear.
As we're wearing the mask, rather than breathing through our nose like you would think, we're breathing more through our mouth.
Temperatures keep climbing.
You add heat, humidity, probably months of more physical inactivity than usual because of social isolation and distancing, and now you mask up, it's certainly going to make it a lot more difficult to breathe, which can lead to further respiratory complications.
So if we know healthy people are unlikely to spread the virus to other people, shouldn't we be allowed to make an informed decision as to whether or not the risks to wearing a mask outweigh the risk posed to people that we have no intention of getting close to in the first place? And are the masks the majority of people are wearing, are those masks even preventing them from contracting the virus? To answer the question of efficiency, I interviewed an expert named Chris Schaefer from SafeCom Training Services. When it comes to knowing more about personal protective equipment, Chris is the one to talk to. For the last 27 years, he has been training medical professionals like doctors and nurses, as well as conducting fit tests to allow such professionals to know how to stay safe. Here is what Chris had to say.
Now, give us a little bit more. I said a little taste of what it is you do and what makes you qualified for this discussion today. But if you could just give a little excerpt about anything that I've missed with that, that would be great.
Well, I am the director of SafeCom. Before that, I was the director and manager of hygiene or training services for a large different companies. Some are billion-dollar companies, some not. But I'm definitely qualified to speak on respirators.
So what do you have to say about people walking around thinking, their DIY masks that they made with all these cool colors, their fashion masks, or even buying them at a fashion store, it matches their top. What do you have to say about people like myself, who used to be like myself, I should say, who think they're safe in walking around with that type of protection?
A respirator is a very specially, sophisticatedly engineered piece of equipment used to filter or deactivate contaminants in the air, one or the other. So not all respirators are designed to filter. Some have attachments that are designed to deactivate other chemicals or problems in the air, right? So just to be clear here is that if you take a piece of cloth or whatever other homemade masks are made out of, and you put it against your mouth and nose, that is not a respirator. That is a mask that is blocking. It's a cover that's blocking your ability to breathe. And anytime that you start to restrict your ability to breathe, and you're not able to inhale oxygen, and you're not able to expel carbon dioxide in a very normal, natural way like we do without a mask, you're going to start experiencing health problems very quickly. Oxygen is essential. The right flow, the concentration of oxygen is essential in the atmosphere for us to lead a healthy life and to be healthy. And as soon as that is reduced or cut off, we start to feel the negative consequences immediately. Mm-hmm. Things that would be signs of oxygen deprivation that we see common with people that wear masks, especially for several hours, would be things like headaches, dizziness, lack of coordination, extreme tiredness. These are all signs of hypoxia, which is oxygen deprivation. Mm-hmm. And it's common because they're not designed to be worn over your mouth and nose. They're not designed to be breathed through. They're not engineered for that purpose. And a respirator is an engineered device. It's specifically for that purpose. Whereas a mask is a cover. And just like we were taught as children, don't put a bag over your head because it could be dangerous.
Right.
Blocking your mouth and nose is not a smart idea.
What are the difference between things like a KN95 and then an N95? How does that pair up when being worn to protect yourself from COVID-19?
Well, that's a good question. And just to clarify, the N95 is an actual certified, tested, proven safe respirator by the National Institute of Occupational Safety and Health. And you can't say that about KN95. So KN95 is a kind of, I think, created. I never even heard of KN95s before COVID was announced. So I don't know if it was something that was just created to give somebody to wear, but it definitely does not have the same regulation or protections or safety testing that an N95 does. And and I've been following and tracking, and I get a lot of feeds of questions potentially on what type of chemicals were made in the KN95, because it seems to be, and this is not my personal experience, but this is just from other people that I'm hearing, is that it seems to be some people are getting ill from some of these respirators coming out of China because of the chemicals that were put into it that wouldn't face the same regulatory scrutiny as they would in North America for the same product.
Well, it wouldn't be the first time something like that has happened from a product coming out of China. What do you have to say about some of these mandates, including in some places children and having to wear it? Some people have backpedaled from this, but having to wear it in school for hours and hours and things like that.
It's a bad idea. It's a really bad idea. None of these masks that people are wearing, these ones with no inhalation or exhalation valves, were designed to be worn anytime. And I'm just talking N95, because N95 is an actual low-level respirator, the lowest protection, in fact, of all respirators. But people aren't using N95s. They're reserved for hospital staff. They're not available to the general public. They're all sold out. Even hospital staff are having a hard time locating actual N95s. So what are they using instead? They're using something like this. Can you see that? Mm-hmm. This style, right? People are using this. And this is not going to filter anything at all. It doesn't seal to the face. It's designed as a cover only. It can't filter anything, not even dust, not even large particles, much less viruses, nothing. If somebody was, let's say, going to be working around sawdust or any type of large particulate, the minimum that I would recommend would be something like this. This is a half mask with P100 filters, with filters rated with 100% protection. It's not going to be 100%. It's not 100%, even at the particulate size that it's rated for. But just to give you an idea, this isn't going to stop a virus. So if this, which is an actual proper respirator that actually seals to your face, isn't going to stop a virus, then you tell me how something like this that is loosely fitted cannot seal to the face at all, along with these cloth masks that if they do seal to the face, they're just going to cause oxygen deprivation. They're not respirators. This isn't a respirator, and a cloth mask isn't a respirator. And if you're putting something that's closely fitting to your face that's not designed to be breathed through, and it's causing oxygen deficiency, that's a slow form of self-suffocation.
But in closing, if somebody really wanted to, if they're like, you know what, I'm not coming out of my bubble here and tell no one has COVID, but then they had to go out and take the garbage out. What would they have to suit up as? What would they have to look like and to actually protect themselves from catching the virus?
You'd have to look like an actual virologist that actually knows how to protect themselves from viruses, which is simply you got to have a whole protective encapsulated suit that would cover you from head to toe, and it would cover all exposed skin surfaces, and it would provide you with a separate source of air separate from the air around you. So to give you an example, most people don't know this, but it's absolutely factual, is that viruses, because they're so tiny, they can enter through your eyes and the surface of your skin just as easily as they can through your mouth or nose. So even if somebody was to say, the argument isn't even this, we know these don't protect against viruses. They don't protect against particles that small. And if people want to say that, they're going to encapsulate big droplets and stuff like that, yeah, maybe some big droplets, a lot of small droplets will come through it. This offers far superior protection to what people are currently using right now. Okay, But even if it was 100%, then you're still going to have virus exposure through the pores of your skin and your eyes. And it's not going to make any real difference at all. And don't block off your oxygen unless you really should be using something that's designed to be breathed through so it doesn't cause hypoxia. Recognize the signs. If you're getting headaches, if you're getting sick, if you're getting nausea, if you're feeling dizzy, there's something wrong. And cutting off your oxygen can be immediately dangerous. We can survive only a few minutes without oxygen. We can survive days without water and weeks without food. Oxygen is definitely the most essential nutrient that we need to stay healthy.
How are medical professionals perceiving you for talking out, I don't want to say against masks, but against masks that aren't designed to do what people are wearing them for?
You know what? Honestly, I haven't really heard much feedback from medical professionals since this whole COVID thing started. There's been a lot of silence everywhere. I've had a few, definitely have had some support, don't get me wrong. I get support from all over the world because I wrote a letter to Dr. Hinshaw June 22nd that was published all over the world, was outlining my concerns with the implementation of N95 non-medical and surgical masks for protection from COVID. So I've received support. I haven't received much negativity. I haven't really received too much comments saying you're wrong or anything like that, especially from professionals. And I don't expect to, because I'm not guessing. What I talk about, I know. And it's just overall just kind of an eerie silence over the whole thing. Nobody really wants to talk too much about it.
Well, thank you so much, Chris, for being on the Rebel News today.
Thank you so much, Drea. It was a pleasure.
If you feel unable to wear a mask at times, Rebel News can help you out with that. We hired a lawyer to comb through the mask mandates and have come up with a mask exemption card that fits your wallet, as well as a big bright yellow mask exemption button you can simply point at on your way in the grocery store, for say. So head to maskexemption.ca to get yours.